Good morning, everyone. So, welcome to today's webinar on the topic of infertility and psychological distress. My name is Winnie Alila, and I'll be your moderator for this session. So, infertility is a challenging and an emotional complex journey that affects many individuals and couples worldwide. So it can lead to significant psychological distress, including feeling of sadness, frustration, anxiety, and even depression. So in this webinar, we aim to shed light on the psychological aspects of infertility and provide valuable insights and strategies to help individuals and couples navigate through this difficult experience. So we'll have two speakers today. Our first speaker will be Dr. Rajesh Totri from Fertility Point, IVF specialist, and we'll also have our next speaker, who is going to be Victoria Rika from Chiromo, Head of Corporate and Mental Health and Wellness Program. So let's welcome Dr. Rajesh. Dr. Rajesh, you can proceed.
Oh, the reaching good person. No, it's not possible.
Hello. Hello, am I audible?
Yes, you're audible, Doc.
Yeah. Good morning, everyone. I'm Dr. Rajesh Chaudhary from Fertility Point. So today I'll be presenting on a topic on a general IVF and infertility and IVF. Just a minute, there is some technical problem. So infertility, it's the definition is the 1 year of well-timed, unprotected intercourse without a pregnancy. And 10 to 15% of the population is infertile in globally, but it may be more in modern age now. 15 to 20% of the couple have unexplained infertility. That means we do all the workup and it is negative. So talking about the cause of infertility, as we know, the cause may be on the man and the woman, or it may not be on anyone. So men will contribute almost 1/3 of the infertility cases. Women will be contributing another 1/3, and 1/3 will be unknown. So in men, the most common cause of infertility is varicocele, and 10% or 5 to 10% will be the genetic cause. 10% will be like for the infection of the testis and reproductive tract, and unknown is 30%, where we do all the workup and we don't know what is the cause of the low sperm count or azoospermia. In women, the most common cause of infertility is tube and ovary reason, mainly the blockage. 30% are like hormonal reason, like PCOS or low ovarian reserve. 10% are the cervical, 20% we don't know. So why there is an increase in infertility now? It's mostly the delayed marriage, sexually transmitted disease, hormonal use of hormonal contraception, rising abortions, and its complication, which can lead to infection of the reproductive tract. Obesity, which is now this cause of infertility because of obesity is growing fastly. Environmental pollution, this is now another matter of concern, which leads to more, it affects more on the sperm count. Sterility from the previous abortion, falling sperm count in males because of the medicine, alcohol. Now fertility clock, it affects women more than men. Men are also affected with the age, but women are affected early. So women, as we know, the women are born with the fixed number of eggs, and as they reach 35, the 80% of the egg reserves are depleted. And by the time she reaches 40 years, only 5% are left in their pool, in their ovary. So as the woman age, not only the number of eggs are lessened, but also the quality of the egg to give a healthy baby decreases. So that's why the best time for a woman to conceive is before 32. But if that is not possible, even 35 can be considered. But after 35, the risk of getting pregnancy naturally is low, and the risk of miscarriage goes high. So we know the first IVF baby was born in 1978, and her name is Louise Brown. So this was the first picture of the IVF baby published in a newspaper. So now talking about who needs IVF. So any other failed treatment like IUI or conventional treatment with medicines, tubal damage, if there is a significant male factor, if there is absent uterus like after hysterectomy or say embark syndrome, or if one of the couple is a carrier of genetic disease, if they want a family balance, if the couple wants a family to balance the family, then they can opt for the IVF and gender selection. Then cancer patient and the couple leading to non-traditional lifestyles which can lead to infertility. So they can be also a candidate for IVF. So the initial consultation when a couple comes to the fertility clinic, so both male and female should be evaluated through medical, surgical, social, and family history is taken. A semen analysis on the husband or male partner is conducted. Physical examination of the female is done. And then ultrasound is done on female to evaluate the uterus and ovary and to see how many follicles are there. And then hormonal tests are conducted. Mainly it is done on the day 2 to day 4. And then after doing all these blood test and ultrasound and semen analysis, counseling is done to the couple and treatment is outlined. Now, if the treatment is planned for IVF, now I'll be discussing on the steps of how a IVF cycle is done. So we start generally we start the IVF cycle from 2nd to 4th day of the cycle, but it can be done any day of the cycle if the patient is on the treatment of cancer or if they are in hurry. But generally we start on the start of the menstrual cycle, because at that point of time the hormones are white and the follicles are small. So we start the IVF injection, and the follicles are monitored. And when the follicles are mature, then we give a trigger with an injection, and then egg pickup is planned. On the same day of the egg pickup, we collect the semen. And if the husband is not able to come on that day, we freeze the semen beforehand. So on the day of egg pickup, the egg is fertilized with this husband's semen, and then we monitor the embryo development in the lab, and the embryo transfer is planned either on the 2nd day or the 3rd day or the 5th day of the embryo development. And after the embryo transfer, we give a medicine to support the pregnancy for next 12 to 15 days. And after 15 days of the embryo transfer, we do a pregnancy test. So this treatment, as per, it takes around 2 to 3 weeks. So now, why we need IVF injections in IVF patient? Because in IVF, we'll need many follicles. In natural cycle, there will be, the physiology is such that it will lead to only one follicle and one egg. But in IVF, because we need many follicles and many eggs, so we give IVF injection, which will modify the physiology of the ovary, and it will lead to the more follicles. So this process is called controlled ovarian hyperstimulation. That means we are stimulating the ovary in a controlled way. And the advantage is there will be multiple follicle growth, so we get more egg, and we can control the timing of the ovulation. Otherwise, the egg will rupture beforehand. We may not be able to collect the egg. And we also prevent the premature LH surge so that egg doesn't rupture before we collect the egg. So this is why we call it controlled ovarian hyperstimulation. Now there are many protocols in IVF. The most common protocol is antagonist protocol. What we follow here at fertility point, 98% of our protocol is antagonist protocol, because this is simple and this doesn't require more than 2 weeks of the patient. And generally on 12th day to 13th day of the start of the injection, we go for the egg collection process. So IVF egg collection or egg harvesting process is a minor surgical procedure. It hardly takes around 10 to 15 minutes. And there is a proper preparation. We give a through counseling to the patient how to come to the clinic on the day of egg retrieval. And we take proper consent, and then sedation is given, and then egg is collected through this ultrasound guided. You can see here, this is a probe, ultrasound probe, which is inside the vagina, and then this probe comes in close to the ovary, and the needle goes inside the ovary, each follicle, and then the fluid is collected in this tube. And then this tube goes to the embryologist, who then collect the egg from that fluids. So this is the ultrasound picture of the ovary. You can see the follicle here, the black round things. These are the follicles. Yes. So after the egg collection, the egg is fertilized with the sperm, and after 3 days, you can see this is the embryo with most likely the 8-cell embryos with grade A. Now, once the embryos are made, it is transferred in the uterus, and with pregnancy and baby. This is how the journey of 9 months, next 9-month journey. Now, the embryo transfer process is a very simple process, and it is simple, but it is a bottleneck procedure. It looks very simple, but it can, if not done properly, it can destroy all the hard work done before. So this must be done under the guidance of ultrasound. Here you can see the uterus and the cervix, and the embryo is deposited in the womb lining here. So embryo transfer, many factors have been proposed to increase the success of this step. Pregnancy rates are significantly increased when a trial transfer is done, when this ET catheter is swapped and is done under ultrasound, and embryo is deposited at the specific point. So generally, the patient, most of the time, our patient asks, doctor, how many embryo have you transferred? I want 3 embryos to be transferred. I want 1 embryo. I want, even someone has gone for asking for 3 to 4, 5 embryos. So there are certain guidelines, and how many number of embryos to be transferred depends on the quality of the embryo and the age of the patient. Also, it depends on the whether they have how many times they have tried before without success or with success. So if the age of the patient is below 35, it's we consider transferring two good quality embryo. Between 35 to 40, 3 to 4 embryo. But the age is not only one parameter. And if above 40 years, maybe up to 5 embryo if it is day 2 or day 3 embryo. But if it is blastocyst, blastocyst, then we may consider transferring 1 and maximum to 2 embryo, or maybe 3. 3 we consider in those patients who are aged and who have repeated implantation failure. We can consider 3 blastocyst transfer. But someone who are young, having good quality embryo, and have attempted for the first time, 1 embryo of blastocyst stage should be considered. Now, after the IVF done, and if it is successful or not successful, ideally IVF review should be done, so that you know what factors have led to the success and what factor has led to the negative results. So that we can go ahead with the plan how to improve the subsequent cycle and give a reassurance and support to the patient. Now, any extra embryo, we generally transfer 1 to 3 embryos, and any extra embryos that are left, we counsel the patient what to do next. Generally, we freeze the embryos, but after successful IVF, and when they have a baby and then they are not willing to go for another pregnancy, then we counsel them to go for the remaining 3 options of like donating for the research purpose, or discarding, or for the giving to the another needed patient. Now there are another specific procedure, special procedures apart from the IVF. They are the assisted hatching. We just make a hole in the cell of the embryo, the outer layer of the embryo. We make a hole by a laser so that it helps in hatching and in implantation. That is a special procedure. Then we do ICSI. That is a now normal routine thing that we are doing. PGD and PGS can be done in a specific patient who needs it. Then freezing and egg donation and surrogacy. These are the other categories of the infertility services. So what factors affect the IVF outcome? It's mainly the female age. Female age is the most important factor. Our 70% of the patient comes after age 38, 39. So at what time that is the age where the number of egg is already compromised, the quality of the egg is already compromised. So and then the success of the even with the IVF is a bit less. Next important factor is the number of egg. How many eggs we get during the IVF? Generally, we target for 10 to 15 egg. So as we age, the number of egg also comes down. So female ovarian reserve is important factor, but sometimes even in young patient, the ovarian reserves are low. But the chances of getting pregnant with one egg is better than the women who are aged and but with less ovarian reserve. Then the duration of infertility is important. Longer the duration of infertility, lesser the chance of success of IVF. Then previous pregnancy history is also important. If the previous pregnancies are not successful, or there have been abortions in between, then the chances of successful IVF is low. Now, cause of infertility doesn't affect the IVF outcome. Whether it is the cause of infertility is because of the tubal block or say low sperm count, the IVF chances are equally good. Now, this slide will show you what is the live birth rate as per IVF as per the age. Now you can see here the live birth rate sharply declines as the age of the woman is advanced. So after the age of 43, 44, it is the take-home baby of a baby, healthy baby, is less than 5%. And in many parts of the world, they deny IVF when they are above 43. So sometimes patients ask us what is the risk of doing IVF and HC. I'll not go on detail on this because of lack of time, but there have been so many studies done, and the main risk of IVF is having a multiple pregnancy, like twin and triplets. But for many, this can be a boon as well. In one treatment, they finish their family planning, but there are complications of having a twin, so that should be considered. And then there are few studies that shows that ICSI can double the abnormality rate than the IVF, than conventional IVF, and then there can be imprinting disorders with ICSI. So the risk to the mother can be hyperstimulation because of the injections, risk because of the oocyte recovery, the pickup, which can be like bleeding and the infection. And then there can be there are some speculation that there can be a risk of ovarian and breast cancer on long-term use. So it's for the long-term use, but not for like 3 or 4 cycle of treatment. There's as per no risk. There are some controversies on IVF, like controversies on like health and safety of the patient, whether to transfer 1 embryo or 2 embryo or 3 embryo, lifestyle issues, then stimulation protocols, and then ICSI can have any risk on the baby or not, like imprinting disorders. Then there are some questions on ethics and morality, like whether to do the genetic gender selection or not, mixing of the embryos and eggs, like designer babies. Then there are some controversies on surrogacies, on gay couples, and cross-border reproduction, which should be addressed through the law of the country. But whatever controversies are there, at the end, what matters us is a $1 million smile of the couple. Thank you. Winnie, thank you.
Thank you so much, Dr. Rajesh. Thank you so much for the insightful session of the IVF process. And now we're going to welcome our next speaker. So this will be Victoria Rika. Victoria Rika is from Chiromo. She's the head of corporate mental health and wellness program. Victoria.
Thank you. I'm very happy to be here this morning. Kindly allow me to put up the slides. I think I'll need your permission to put up the slides.
I think so, yeah. Okay.
So thank you. So I'll just skip some of the slides because the doctor has already talked about, mainly the causes of infertility and what have you. But in summary, from the World Health Organization, we see that statistics show that about 1 in 6 people experience infertility in their lifetime. And like the doctor said, that this infertility may occur due to female factors, male factors, and a combination of both. And sometimes it may also go unexplained. So when it comes to psychological aspect, the diagnosis and what follows thereafter does definitely put a very heavy psychological burden on most patients. And the incidence of depression and anxieties in couples who are presenting infertility is usually higher than fertile couples. And that is quite something worthy to note. So we'll skip on the types of infertility and we will look at the myths that are there on fertility. That sometimes people will talk and you'll hear someone saying that you have to wait 1 year to seek help from a doctor. Again, you'll hear someone saying that infertility is most often the woman's fault. A fertility clinic will always recommend IVF. That is also a myth. If you are under 35, you won't have fertility issues. Basically, you can have fertility issues at whatever reproductive age. And sometimes someone will tell you if you just relax, it's going to happen. That is also a myth. So how does infertility affect your mental health? And first of all, before we talk about mental health, it's good for us to understand in general, when we say health, what are we talking about? And again, we refer to the World Health Organization definition that health is that state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if you're not suffering from malaria or from cancer, would we still say you're healthy if your mental and social well-being is not in a good place? So what again is mental health? And the definition is that mental health is that state of well-being in which every individual is able to, number one, realize their own abilities, realize their full potential. That means where you're working at or where you're placed in society, you're able to realize your full potential. You're living to the best of your ability. And then are you able to cope with the normal stresses of life? And normal stresses of life could be things like traffic jam. It could be you had an argument with someone at the workplace. Are you able to handle your emotions, or do you find yourself projecting on the other workmates? Are you also being productive where you're working at? Are you making a contribution to the community? So if you meet this definition, then we say that you have sound mental health. So for you to know if you are experiencing mental health, then again, we say these are the key features. So you realize your full potential, you can cope with normal life stressors, you're working productively and fruitfully, and you're making a contribution to the community. So if you're lacking in one of these features, then we would say that you're struggling with your mental health. So how does infertility affect your mental health? Now, the inability to conceive a child is akin to recovering from a certain loss. So we will look at the stages of loss, but let us look at what it really does in terms of your psychological part. So you'll have loss of interest in usual activities, right? Sometimes you may have depressive feelings, which do not go away. And the more you try, the more you're unable to conceive, then the further the depression. And sometimes you have strained interpersonal relationships, especially if you come from a culture where the parents, the aunties are really asking, when is this child coming? When is my grandchild coming? And that can really, really get on your nerves. And sometimes you'll find yourself avoiding social gatherings because that question of when is the grandchild going to come will still pop up from someone within the larger family. Then you may become very obsessed with the thoughts of your infertility. So you don't think of anything else. You go to work, so you don't become productive. You go for whatever gathering in the community, maybe church, maybe for burials, and the only thing that you keep on thinking about is your infertility. You may also have very high levels of anxiety, especially if you're trying to conceive. Maybe you go and see the doctor, and maybe he recommends particular tests. And if it's your first time, of course, you're anxious, is it going to work? If it is your second time and it didn't work the first time, you're asking yourself, is it really going to work? So your levels of anxiety remain very high. And then, of course, you have that diminished ability to accomplish tasks, because when you're stressed, then your cognitive functioning becomes impaired. You may find yourself having difficulty with concentration. So you're there at the workplace, you're there at whatever other place, but you have zero concentration. Your sleep patterns may also change. You may find yourself having difficulty staying or even falling asleep, and sometimes you'll find yourself sleeping more than usual. Again, your appetite may shift. You may find yourself eating too little, or you may find yourself doing what we call comfort eating, so you have an increase in weight. Then you may find yourself trying to cope in the wrong way, so you start using substances, you start using drugs or alcohol. And remember, if at this point you're also using prescription pills, for example, to get some sleep, you're also using them in the wrong way. So they become abused instead of helping you for just a certain period of time before you somehow get used to sleeping without prescription medication. If the depression does not lift, then you may start thinking about suicide. What am I good for? If I can't, impregnate a woman, if I can't conceive, what am I good for? So you may start thinking about suicide. And sometimes you find yourself isolating yourself socially. And you'll find yourself avoiding birthday parties or baby showers or anything that reminds you of your infertility. Then you become very isolated. And remember, depression really loves isolation. So you may get into a place where you become very, very depressed. Then you'll have feelings of pessimistic, you feel very negative towards the future. You may feel guilty. What have I done or what have I not done? You may feel worthless. So all these negative feelings may really be a part of your psychological makeup at this point when you're experiencing infertility. And again, you may also have feelings of bitterness or anger towards yourself, towards your partner, towards the higher being that you believe in, even towards the doctor. And you may find yourself moving from one doctor to another. So at that point, when you're stressed, then what happens to your body? What happens to your mind, your emotions, your behavior? Because something clearly is happening. Stress is your body's natural response towards a threat or a demand. And we all have an element of stress. And mostly, if you're able to overcome stresses, the everyday stressors of normal life, what we call normal life, then ordinarily you may not get these symptoms. But if your stress levels are elevated, the stress is chronic, meaning you wake up to this stress every day, then you'll find yourself having some migraines, some headaches, not able to explain. You may have sleep disorders. You may also have chronic illnesses, skin conditions, flus, colds. Why? Because when you're stressed, your immune levels go down and you become very susceptible to infections. So you can see all these things that happen within your body. When it comes to your mind, your cognitive functioning, we said, is impaired. So you have worry, negative thinking. You may find yourself having things like nightmares. You become very indecisive. You may become a very negative person. You may also have a lot of impaired judgment, forgetfulness, and a lot of distress. So all this is going on in your mind, but the root cause is because you have come to a point where you've been declared infertile, and maybe you're working only towards achieving conception. When it comes to your emotions, you may be a very angry person. Remember, we said you're probably bitter towards your partner, towards the doctor, towards God, or whatever higher power you believe in. So you may have a lot of anger issues. You may feel very hopeless, especially if the treatment plan does not seem very straight in terms of your understanding. You may lack confidence, you may become very irritable, and you will find yourself getting depressed. Your behavior, you may have loss of appetite, like we've already mentioned. You may also try to cope with the negative emotions by taking things like alcohol, other drugs like marijuana. You may also find yourself self-harming, because when you get to a place where you become very depressed and feel there's no need to life, then you may start doing what you call self-harming. And at some point, you may even start thinking suicide and maybe even attempt, especially if the pressure to conceive or produce a child becomes very high. So we've said that when you do not have that ability to conceive, or when you're not conceiving, there's some period when you're declared infertile and you're not able to conceive, then you may go through the 5 stages of the grieving process. Now, this process is not linear. It does not have to go the way we've shown it there, but usually it follows a general curve. So maybe you go to the doctor, you've been trying to conceive, and they tell you you're not able to carry a child, or you're not able to impregnate a woman for whatever reason. We've said it could be male or female factors. It could be a combination of both. And at times you do have what we call unexplained infertility. So you go into a mode of denial. This can't be happening to me. My mother conceived, my father has impregnated, and we have so many children. my sisters, you look at your clan and you see everyone has been able to bear a child. So it can be that I am not able to do what? To bring forth a child. So you go into denial mode. And at this point, you may be at a place where a lot of emotions are happening. Then you may move on to anger and you start questioning, is that diagnosis really, really correct? So you may become very angry. And at some point you go to a place where we call bargaining. And bargaining is where you tell yourself, if 1 or 2, 3, if this thing happens, then I'm going to do 1, 2, 3, right? Then you may get to a place where you become very depressed. If you stick too much on these negative emotions, you feel overwhelmed, you feel helpless. And finally, you should come to a place of acceptance and say that this is what has been given as a diagnosis. And when you come to acceptance, and you're able to now have a roadmap, right? So you start exploring options. Are we going to do IUI? Are we going to do IVF? Are we going to do adoption? So you put a plan into place and you start moving on. But you make it to acceptance, and tomorrow you wake up and you're so angry at yourself because I'm not able to conceive, I can't impregnate a woman, or you're so angry at God because he's not allowing this to happen, or whatever higher power you believe in. So remember, the process is not linear. You don't move from denial to anger in that. It's not systematic, but you can move from one to the other. But finally, where you feel safe is when you get to a place called acceptance. Then we say that there is help. And it is very important during infertility treatment that you have discussion with a mental health professional. Most of these assisted reproductive clinics, you will find they usually have a counselor who is there with you from the start to the end. And it is important for you to have a sit down with them so that you understand the procedures, you explore your own feelings about these options, and they're able to help facilitate clarification of your thinking and also help you with making certain decisions. So if you do consult the mental health professional, how will they help you? They'll help you decide between the alternative treatment possibilities that maybe the doctor has laid out. If you need to explore other options when it comes to building up your family, they'll be there to work with you. And then also, if you're having difficulty communicating what you really want, or you have different ideas about the direction you want to take, then a psychologist or a counselor will work with you to give you direction or to tell you this is what you should do, but to work with you on what you decide. So the primary goal for psychologist or the counselor is just to help you cope with physical and emotional changes which come about as a result of infertility. How you will focus or deal with your partner's response is also key, because especially if the partners are not in a place where they're understanding each other, they could be the blame game, then it is important for you to see a therapist who can help you deal with your partner's response. And then also, how do you control your stress? How do you control your anxiety at that point when you're going through infertility treatment? So if we look at how to cope, number one is check for depression and other mental health concerns. And we've already defined what mental health is. So if you're not meeting that definition of mental health, then it's important to ask yourself, could I actually be depressed? Could I be suffering from anxiety? Could I be having other mental health concerns? And these are usually very subtle. Sometimes it's just withdrawal from normal things that you love to do. Sometimes it's your appetite change. Sometimes it's your sleep patterns which have changed. So it is important to check for those signs. Give yourself permission to be angry. If you encounter loss, whatever kind of a loss you encounter, it could be loss of a job. It could be you lose someone through death. You have those emotions that you're experiencing. So we say it is okay for you to feel angry. It is okay for you to feel sad, but do not get stuck on the emotion. Process the emotion and then have a game plan. Number three, don't blame yourself. Sometimes these things are beyond us, right? And then rely on the support of friends and family. Engage in self-care, and I'll give you a slide on self-care. If you do not feel at a point where you want to go for baby showers or birthday parties, whether it is for your relatives or your friends from the workplace, say no to baby-related activities, because most of us experiencing infertility, anytime you see a pregnant woman or you see a newborn baby, it stirs up very, very raw emotions in you, and you start feeling depressed all over again. Then look for ways to create meaning to your life, and that falls under self-care. If you and your partner would like to go for couple therapy, that can also help, or if you can join a support group, either a conventional one or even within the church or community. And then it's important, and the therapist will tell you this, that you set a limit on how long you're going to try. You don't want to keep on trying endlessly, because the more you try, the more it does not work, the more you get disappointed, and the more you get to a place where you feel your mental capacity is really, really being tested. So it is important to know what options do we try and for how long, and after that, what other choices do we have? And then give your partner permission to cope differently than you. Remember, we are different personalities, we cope differently. Some of us are very rugged and able to go through something very, very hard in a very easy way, but some of us literally drown. So allow your partner to breathe in their own way. And then also reestablish intimacy with your partner. Because when you're going through infertility, sometimes it's about, timing that this is the right time to have sex. So the intimacy kind of becomes very put aside, and sex becomes something very mechanical because you're just doing it for the sake of procreating. And then be realistic, but also optimistic. Now, if your friend is going through infertility, or someone is going through infertility, then what are you supposed to tell them, or what would be helpful? Something like telling them, I am thinking of you, would be very helpful. What may not be very helpful is asking them, have you tried 1, 2, 3, right? Because if you know they're going through the process, support them and tell them, I am thinking of you, whatever it is you're going through, I am standing by you. Then don't tell them, I know someone who did 1, 2, 3 and fell pregnant. Instead, tell them that I am happy to listen anytime you'd like to chat. Let them try and rationalize what is happening in people's lives, right? And tell them everything happens for a reason. Sometimes when you've lost someone to death, someone will come, meaning very well, and they will tell you that, all work together for good, there's a reason for this, and let them go through the process in a way that is making sense for them. But if you come around and tell them everything happens for a reason, they'll be wondering, so what reason is there for me not to have a child? What reason is there for me not to be a mother or a father? But what would be more helpful is telling them, I really admire your grace and resilience, and know that I'm sending so much love your way. Don't tell them just relax and try to stop stressing. Don't tell them maybe it is not meant to be. Don't tell them you can have my children anytime. Don't tell them at least you get to sleep in, no interruptions or disturbances from children. And then probably sometimes you tell them maybe try and change your diet. Offering advice, which seems very helpful, but at the end of the day may not be very helpful. So what would be more helpful is to tell them how you feel is valid and completely understandable under the circumstances. You can tell them what, say we go for a dinner date or a spa date together and have zero talk about babies and children. And maybe what you can also tell them that would be helpful is that you're not doing anything wrong. It is just really hard. Let them go through the process, let them feel the emotion, support them in whatever it is they're experiencing. And finally, let them also do self-care, or be the one doing self-care if you're the one who's going through infertility. Ask for help. We've already talked about that. Sometimes spend time by yourself doing something that you really like. You could be watching a movie, you could be just doing a cup of coffee by yourself. Put yourself first and create boundaries. For when you want to be by yourself, create that time. Ask for what you need. If you want to stay at home and not join the other ladies for a baby shower or for a party, stay at home. Be able to say no for things which do not appeal to you, and just take a step back and relax. So that self-care regimen can be very helpful and help you through your journey of infertility, or through someone who's going through infertility. And with that, I would like to hand it back to the moderator, and then probably we can see if there are any questions that we'll be glad to take. Thank you for your time.
Thank you so much, Lisa. That was great. So we do have 3 questions. So we have 2 questions for you, Madam Rika, and then one for our IVF specialist. And the questions that we have online from our Facebook page is, are there any specific support groups or therapy options that you'd recommend for individuals seeking emotional support during their infertility journey? You had mentioned that you advise individuals to seek support in churches, but so the question is there a specific support group or therapy options that you'd recommend to these patients?
Thank you for that question. So on specific therapy groups, support groups, yes, we do have one. We do have one at Chiromo Hospital group. You can get in touch with me and I'll be able to direct you on that. What was the second question?
The second question was, I didn't mention the second question, but this is the second question. Now, this is from us, like a healthcare provider. How can a healthcare provider better support individuals or couples dealing with infertility related psychological distress? What would be your advice to the healthcare provider?
I think I'll still go back to them seeing a professional therapist, a professional psychologist who can give them the support that they require. Because one, there needs to be very good communication between the two, the couple that is experiencing infertility. Because if the communication is not clear for them, then probably there'll be a blame game and there'll be someone who will not be giving the other one the space to experience this infertility in a healthy way, if we can call it in a healthy way. What do I mean by in a healthy way? In a place where you feel your spouse is supporting you. So if you go for therapy, then the communication channels can be worked on, and then understanding what is causing the infertility can also be worked on in therapy. And then things like, what are the options, because sometimes you can try and, go through these, the treatments, and maybe it's not working. So what are the options? Is something like adoption an option for us? And of course, that again needs therapy, because adoption is not just for the couple, but it will also have an impact on the bigger family. Are we able to withstand that pressure? So if we go for therapy to a counselor who understands the whole concept, then you get that psychosocial support that you need to keep the relationship going, because infertility has been known to tear couples apart. So that would be the work of the psychologist to support the couple that is experiencing infertility through the psychosocial aspect. Thank you.
Thank you so much. Thank you so much, Madam Rika. Okay, so to our IVF specialist, we have two more questions on our chat. So the first question, please talk about harvesting eggs for women when younger for use later. This question came from Frida. We're hoping that Dr. Faith can answer this.
Hello, everyone. My name is Dr. Faith Mushira. I'm a medical officer at Fertility Point. Sorry, Dr. Rajesh had to step into a procedure. So it's a good question with regards to egg harvesting. So for women who probably want to pursue their career and they're not ready to have kids at a particular age, yes, it would be advisable to do egg harvesting. The process is usually the same, just like any patient would come for an IVF procedure. However, at the point whereby we are meant to combine the egg and the sperm, we usually freeze the eggs that are retrieved from the lady. It can also apply for patients who are under treatment for cancer. As we know, cancer treatment usually depletes the eggs of a lady. So a doctor who's seeing such a patient should refer the patient to a fertility center. At that particular point, we are able to harvest the eggs, freeze them such that when after the cancer treatment and this lady would want to get a pregnancy in future, we can use those frozen oocytes to achieve a pregnancy. What is the other question, Minnie?
Okay, so the other question is, can you come I think the question is supposed to be, can you mention the types of infertility? I think that is what they were trying to ask.
Okay, so broadly, infertility can be divided into two forms. We talk about primary and secondary infertility. Primary infertility would refer to a couple who have never achieved a pregnancy before. And then for secondary infertility would be a lady has gotten pregnant before, but now they're having difficulty getting a second or maybe a third pregnancy.
Okay, thank you so much, Dr. Faith. So those were the only questions that we had. Now there's another one. How much does it cost to freeze the eggs? A rough estimate.
A rough estimate of oocyte freezing in most of centers in Kenya would be between 100 to 200,000. And then, of course, there'll be some yearly charges as depending on the number of years that the freezing is going to take place.
Okay, thank you so much for that, Dr. Faith. So is there anyone else maybe with a question before we wrap up the session?
Excuse me. Not a question as such. Hello.
Hello. Okay, we can start with, yes, we can hear you, Vespers. Let's start with Vespers, and then there was another lady, Mercy, if I'm not wrong.
Okay, thank you very much. This session was very much informative. I'm a counselor working at the Mariakani Sub-County Hospital, and I've really loved the mental health issue in relation to infertility, because this is some of the things that we do and we handle clients every day. So this one was very much informative to be able to help us continue and having a boost to be able to support our clients. Mine is not a question, but it was something that I've seen of late, because I've received quite a number of clients who need counseling, and also these are boys between the age of, I think between the age of 15 to the age of 25 there, and a number of them are practicing masturbation. How I'd wish that Chiromo can be able to look on this and be able perhaps come up with some support on this. Thank you.
Thank you very much, Vespers. We had another question from Mercy, no, from Akelo, sorry.
Yeah, thank you very much for the opportunity. I'm sorry I came late. I might have something that had been spoken about earlier. Is there hope for someone who just turned 45 years to conceive? She has suffered primary infertility. So that's a question, at least for the person to know. Thank you.
Dr. Faith, maybe you can answer that.
Yeah, sure. So yes, it is possible for someone above the age of 45, but as of note, just like Dr. Rajesh had put it, usually it becomes very difficult for ladies above the age of 43 to get a pregnancy, especially using their own egg. However, there are other third-party programs that are offered, whereby we counsel a patient in terms of what egg donation involves, how the process involves, and if it's agreeable to the couple, then yes, that's an option the lady can look into. So basically, if a 45-year-old comes to see us at the clinic, first we'll evaluate, see what is their fertility chances. Are we able to achieve a pregnancy with their own egg? We'll explain to the patient the success rates. We'll tell them the options, and then at that particular point, they can make a decision whether they would be able to go for a donor egg, if that is what would be the desired method of achieving a pregnancy.
Okay, that is great. So we proceed to our next question. Is it important for us to do fertility tests if we want to wait?
Yes, yes, it is important for any person, male or female. And if you're not ready for a pregnancy, you probably want to pursue your career and all that, it's good to consult a fertility specialist to advise you on what will be the disadvantages of waiting for that long. What are some of the things that needs to be done? For example, we can evaluate, if it's a male, we can do just a basic semen analysis to know how their sperm is, and then we can advise them that by at a particular age, that count could also go low. For the women, we can also advise, can you go for egg harvesting, or maybe we tell you at least by 35, then you can also plan for pregnancy. So yes, it is good to do basic fertility tests, whether you're trying for pregnancy at that particular point, or you just want to wait and maybe pursue pregnancy later in life.
Okay, that was amazing. So our next question is directed to Madam Rika. So Madam Rika, the question is, how does a counselor help a couple with infertility issues, but are taking rather long to deal with the anger and bitterness towards both God and the society?
Thanks for the question. I think for a counselor or a psychologist to help a couple with infertility issues, number one is teach them, coping skills. Let them acknowledge the hard feelings, because what they're going through is an experience which they need to process, right? And it's a hard experience. So let them be able to express their emotions. We said let them express their emotions. If it's anger, if it is bitterness, but not get stuck on them, not get fixated. So a therapist will help them to acknowledge those feelings and then be able to move on. To tell them that if you harbor all those negative feelings and not talk about it, it's like a pressure cooker. If you keep on stifling and stifling your emotions, at some point it's bound to explode. So let them acknowledge the hard feelings they're having, the feelings of bitterness. Help them to move from there by practicing gratitude. I may not be able to conceive a child, but what else is there to my life? Maybe I have a good job, maybe I have a very supportive spouse, maybe I have a great family. What other blessings can I count away from what is not happening to me in terms of me conceiving? So once you help them also practice things like gratitude, they get to see the bigger picture, that life may not just be about one thing to do with fertility or infertility, but the other blessings that I can count. And you're working with them in that journey of infertility, whatever the outcome may be. Remember, we've said that at the end of the day, not all infertile couples are going to be successful in conception. So even for them to acknowledge the whole journey, that yes, we are going to try all these, but at some point, we may also not consider other options like adoption or just being child-free. So helping them through that process, expressing all the emotions is usually what a good therapist will help them do. I hope that has helped. Thank you.
Okay, thank you so much, Madam Rika. That is fantastic. And now our next question goes to Dr. Faith. How much is the IVF process, and what is the best age of harvesting the eggs?
Yeah.
Dr. Faith, you're not audible.
Am I audible now? I think it's okay now. Sorry
Yes.
about that. So,
Okay.
yeah, those are good questions. An IVF procedure, it is quite, would say, expensive to majority of Kenyans. However, the cost is usually approximate 400 to 450,000 Kenyan shillings. However, there are some insurance agencies that are able to cater for the procedures, for the IVF procedure. And we're also encouraging more insurances to come up and cover the cost of this procedure for the patients that need them. The other question with regards to egg freezing, I think that's what the question meant. The best age is before the age of 35, because usually after 35, that's when there's a significant decline in the fertility of women. So ladies below 35, that would be simply the best age for egg freezing to happen. Even better if it is young at around 25 to 30 years. Thank you.
Thank you so much. Thank you so much, Dr. Faye. That is amazing. Okay, our next question is, fertility treatments are very expensive. For those who cannot afford to pay the total amount at once, is there any other payment plan, especially for those who can't pay the whole amount at once? Okay, so I think I can answer this. So at Fertility Point, we do have payment options. Okay, so you can, once you've come to the clinic, the doctor has written you the treatment plan. You undergo a financial discussion session. So during this financial discussion session, we can discuss on how flexible you are to make the payments. So you can make the payments in bits. Maybe 1, 2, 3, even 4 bits. We can come into an agreement and sign against it, Also, apart from that, we also have other financial institutes that support IVF treatment, whereby they can loan you. Okay, they can loan you towards the IVF treatment process. So that is also another payment method mode that we can take you through at the clinic. So if you feel like you're in need of fertility treatment, you know your budget, and you feel like you need what we'd advise is that you just come to the clinic after you've seen the doctor. Once the doctor has advised on the treatment and the treatment plan, we can help you discuss on the treatment options. Okay, I hope that is well answered. So kindly share with us the insurance that are covered, that cover fertility treatments. Okay, so currently in Kenya, we don't have insurances that pay for fertility treatments, but we do have employers that do pay for fertility treatments. So fertility treatment, this is to mean IVF treatment. So among the employers, we have teachers, TSC. We have TSC teachers, we have NPS for police, we have KRA, we have KCB, and then we also have international insurance like Cigna and Bupa. Okay, I hope that is also well answered. Head to our next question. Is the 450,000 cover if you want an egg donor? No, an egg donor is a separate service that goes for 150,000 Kenyan shillings. Okay, the questions are becoming many. Can we have another webinar next time on the issue raised? Yes, Richard, we can have another webinar. Thank you so much. Okay, so that was the last question. So I would like to take this time to thank everyone that has spared their time to participate in this webinar. I hope there's no any other question that okay, there's no any other question. So lastly, we want to thank all the participants for their active engagement and thoughtful questions during this session. So we appreciate our speakers, Dr. Faith from Fertility Point. We appreciate our guest, Dr. Rika. Thank you very much. That was insightful. And we'd also like you to advise us on how patients can be able to reach you if they're in need of your services, Dr. Rika, before we end the session. And also, thank you so much, Dr. Rajesh from Fertility Point, for insightful IVF or fertility treatment process. So once again, thank you so much for your valuable contribution. We are grateful for your dedication. And thank you for making today's webinar a success. Thank you so much. Thank you so much, everyone, for joining. Madam Rika, if you can advise us on how we can reach you so that we can end the session. Okay, it's like Madam Rika is not available online, but she's from our partner, that was Chiromo. So maybe if you are interested in their services, you can check out their websites. But as for Fertility Point, you can also always reach us on 0792 111 222, or you can reach us on our website or visit our clinic at 40 Suits Building in Upper Hill, Nairobi. Thank you so much. Have a great day.